Hello everyone, and thank you for taking the time to watch our third video update on the department's response to the novel coronavirus, or as many of us call it, COVID-19. As we continue to work through our third week of this pandemic, significant changes continue to occur. The governor has issued a stay-at-home order lasting until June 10th. The reported positive cases in the state has increased to 1,484 people, and the city of Virginia Beach has 88 confirmed cases. As a department, we are continuing to stay up to date with the most current recommendations from the CDC. We are working closely with our healthcare partners to analyze trends to the disease progression. But most importantly, we are exhausting all avenues to provide you with personal protective equipment to keep you safe. As a system, we are strong. Staffing levels are good, response times remain unchanged, and patient care continues to be outstanding. But times have changed. We have been forced to place increased levels of social distancing among providers. We have had to limit the number of providers allowed to transport a patient. We've had to discontinue observer rides on ambulances. We've had to limit students. And most importantly, we've had to wear masks the entire shift. We have temporarily taken away the sense of community and togetherness that helps our EMS system work. But please don't get discouraged. Soon enough, we'll be able to joke around, gather at Wawa, and go to our favorite restaurants while on duty. Until then, please take this seriously. Please be open to station assignment changes. Please understand that your normal partner may not be your normal partner for the shift. Please understand that being clean-shaven is needed to keep you, your partner, the patient, and the community safe. Please understand that the EMS supervisors are doing their best to make operations safer and more efficient during these times. With that said, these are the new changes we need to discuss this week. We have issued guidance on facial hair and grooming standards, updated PPE requirements on surgical masks, stocked standardized PPE ensembles in all ambulances, solidified processes on first responder COVID testing, and updated guidance regarding cardiac arrests and arriving at the hospital with both STEMI and intubated patients. The most dramatic update deals with grooming standards, which applies to all patient care providers, career and volunteer, to include students, interns, and released personnel. In other words, if you are staffing an ambulance, it applies to you. No patient care provider shall have a beard or facial hair that does not allow you to obtain a full face mask seal while wearing a respirator such as an N95. Be advised, the Department of EMS recommends that all males be clean-shaven. Requests for accommodations based on medical or religious purposes should be directed to Division Chief Kevin Lipscomb. He is the Department Safety Officer and our primary interface with occupational health for this pandemic. If the member fails to follow the CDC recommendations and department direction regarding this issue, EMS supervisors have the authority to remove the provider from duty for their own protection, the protection of their crew, as well as the protection of patients until the issue is corrected. Anyone with questions on appropriate facial hair per CDC guidelines, please revert back to Chief Lipscomb's email. Going to take a few words from a message that you probably saw over the last couple days. Be sure you're apprising and advising before compromising. Every time you put on an N95 mask, do a user seal check. Exhale gently through the mask should puff out and you should not feel air escaping next to your face. Inhale gently and hold your breath for 10 seconds. The mask should collapse slightly and stay the way while you hold your breath. If you can't get a good seal with an N95 mask, let a supervisor know immediately. We might be able to get you a different style, or maybe someone else should be assigned to care for the patient. We urge all providers to remain vigilant and comply with all imposed safety regulations for their own protection, for the safety of our patients, and for the safety of our community. I want you to keep up the great work using PPE. We have quickly adapted to using proper PPE appropriately. Please keep in mind, surgical masks are to be worn for the entire shift to include times when social distancing procedures are not able to be maintained. So yes, this means in the station, driving in ambulances, and sitting in the day room watching TV. To make life easier, we have standardized the ensembles and placed them in the same compartment on every ambulance. Each ambulance will have the PPE kept with the bleeding control kits located in the top, back, inside compartment of the driver's side on an ambulance. Each ambulance now has 4 full PPE kits in individual bags, 6 N95 masks, 5 surgical masks for patients, 6 surgical masks for providers, 4 reusable eye protection, which needs to be cleaned after each use. Please keep in mind that we need to conserve N95 masks when prolonged close contact and aerosolized generating procedures are occurring. Remember, the virus can linger in stagnant air for hours. I want you to keep protecting extra personnel. Unless you need the extra hands in the back, have thirds ride to the hospital separately or up front. No family member should be transported in the ambulance unless the patient is a minor, there is a language barrier between the patient and the provider, or there is an altered mental status situation. Please be judicious in determining the need for a family member to ride with an altered mental status patient. COVID-19 is widespread in our city. We have reached a point where COVID-19 is community acquired. This means travel is much less of a concern. There's plenty of reason to believe that lots of our patients do indeed have COVID-19. If you think a patient may have COVID-19, they probably do. Put a surgical mask on them. Additionally, please do not make social media posts about places where COVID-19 patients are located, such as a nursing facility. This is not our place to do. We are starting to see atypical presentations. Don't be fooled. The hallmark symptoms of COVID-19 are described as fever, dry cough, and shortness of breath. But other symptoms, sometimes the only symptoms, are actually quite common, including body aches, back pain, abdominal pain, diarrhea, nausea, vomiting, and headaches, hypoxia without dyspnea and with decent lung sounds, chest pain of any quality, loss of smell, fatigue, new onset CHF. You should also be aware that patients and family members aren't always getting, understanding, or reporting accurate information about their COVID-19 status. We have been told all of the following about patients who ultimately turned out to be COVID-19 positive. The patient was tested, but test came back negative. That was then, this is now. Also, the test is very sensitive, but not perfectly so. The patient was flu positive. This didn't mean that they were COVID negative. The patient was diagnosed with pneumonia, which can be caused by many things, including COVID-19. Doctors are sending some patients home with COVID-19 pneumonia. The patient hasn't been around anyone with COVID-19. How would they know? People can shed this virus before they develop symptoms, and we are in the community-acquired state. The patient is probably septic, which could be caused by COVID-19. The patient just fell and hit their head. Why did they fall? COVID-19. Our case review and surveillance processes are changing. We are now seeing too many potential COVID-19 cases to review individually. Going forward, we will only be reviewing reports of problems with PPE and cases that were dispatched as high risk. Please let an EMS supervisor know about such problems immediately. Many of you have asked, how do we, as first responders, get tested for COVID-19? We finally worked out the procedure. If you are exhibiting signs and symptoms related to the virus on or off duty, notify an EMS supervisor. You will be directed to go to Sentara Princess Anne Hospital and enter through the medical tent outside the emergency department. Take your Virginia Beach EMS ID card, as you will need to identify as a first responder with Beach EMS. Do not give personal health insurance information. If you have difficulties, contact an EMS supervisor. Get yourself tested, follow the guidance from the ED staff to manage symptoms, and you'll be relieved from duty until the department has the results. You should notify Division Chief Lipscomb when the results are in. He is the functioning agent for the OC Health team. Our emergency department processes have been altered as follows. STEMI patients at all Sentara facilities will be stopped in the ED for registration and evaluation for risk of COVID-19. We will not take them directly to the cath lab. When you are bringing an intubated patient to the hospital, contact the receiving hospital when you arrive on the hospital campus to let them know you're there. The staff will meet you at the ambulance, put an inline filter on the tube prior to allowing you to enter into the emergency department. Some hospitals may put the patient on a portable ventilator while they're still in the ambulance. Please be flexible and have patience as we move forward with this. Cardiac arrest patient management needs to be slightly altered. We want ALS providers to exercise critical thinking along with sound judgment in determining whether or not to work a cardiac arrest. Additionally, unless you have sustained return of spontaneous circulation or ROSC after 20 minutes of working the arrest, contact online medical control prior to moving the patient to a stretcher for consultation. You may be given termination orders. In closing, we need you to help flatten the curve. Slowing the spread of COVID-19 keeps PPE on our units, keeps beds open in the hospital, keeps healthcare providers from getting sick, and saves lives. So, when you're on duty, wear at least a surgical mask whenever you are close to others, in the ambulance, on a call, or in the hospital. Take social distancing seriously. Be clean shaven. Wash your hands. And follow Governor Northam's orders. As always, we will update you as we receive more information. Please check your email on the webpage before you come to duty. A frequently asked question sheet has been posted on the VBEMS webpage. For now, stay safe, stay informed, and thank you for your continued service to our community.